Good afternoon, everyone. Will Dupree here in the KXAN live studio. We are awaiting a press conference here in just a few moments, a virtual call with the City of Austin Mayor, Steve Adler, the Travis County Judge, Sarah Eckhart, and Dr. Mark Escott, who is the interim health authority for Austin, Travis County here at the moment. They're going to be discussing the new stay home, work safe order that was issued starting last night. And here is the 22-page order that Travis County signed into effect. Again, it went into effect last night or this morning at midnight, I should say, to be very specific about that. And not only does it extend these requirements about essential businesses and essential work and activities until May 8th, it also requires face coverings for people that go out into public, anyone who's over the age of 10. It sounds like everything is getting started with this particular feed. It's showing black at the moment, but I'm hearing audio. So let's take a listen as the mayor, Travis County Judge, and the interim health authority for Austin, Travis County get underway talking about this extended stay-home order.
Orders that have been in place now for about a month. The orders are the ones that have had us sheltering at home and only going out if we have to do something that's essential or critical. Those orders expired last night, so we extended them. We extended them through May 8th. You may recall that the president's order goes through the end of April. The governor's order goes through the end of April with their orders. We went a week beyond that till May 8th. Generally speaking, the orders that we entered, the extensions, very much like the orders that we have had in place. And I really want to thank the community for working with those orders. We're doing well. We still are not out of the woods and can do better. But there are a lot of people that are working really hard. There are two things with this order that I just want to touch on that are different. The first, and I think most significant, is the provision that takes the recommendation we had been making about wearing face coverings for everyone when they go outside. It now makes that mandatory. It says something that each of us now need to be doing. We're talking about face coverings, which are fabric over your nose and your mouth. We've seen the videos. This is something you can do at home with a bandana or a t-shirt or something that you buy. It takes literally 30 seconds to do it with materials you have around the house, if that's what you choose to do. But at this point, the order now says that if you go outside, you need to put on a face covering. The exceptions to that are if you're going to be alone in a space, either outside or inside, if you're traveling alone in your car. You also don't have to do it if you are around only the people that are living with you in your household. You also don't have to do it if you're engaging in an outdoor activity like you're running or jogging or walking around. You don't have to do it so long as you're doing that by yourself or with someone that's in your household with you. If you're doing it and you're around other people, then you should put on the face covering as well, or if you're actually eating or drinking. The reason we do this is because we're still seeing that this virus is something that can be transmitted. When you put on a face covering like that, probably does not protect you from getting the virus. But what it does do is it makes it a lot less likely that if you have the virus, whether you know it or not, if you have it, it makes it a lot less likely that you'll pass it on to someone else. You know, quite frankly, if we go into a grocery store right now, for example, the clerks that are there all day, they're around lots of people. And we owe it to them. I think we have now a moral obligation, now a legal obligation to make sure that we wear those face coverings in order to protect those clerks that are in the store. It's the people around us. Certainly, if everybody in the store were wearing the face coverings, then all of us that are in that store would have that added protection too. But we're going to do this now. It is really a selfless act. We're doing this to help keep those around us safe. And if everybody does it, then each of us are made more safe as well. The second provision that we had talked about enforcement. It recognized that these kinds of orders carry with them criminal penalties and the force of law. But we also recognize that so much of these orders, as you have seen, require us to self-police. For us to, we're never going to have enough sheriffs or police officers to actually enforce this that way. It's got to be something that we want to do in the community, that we want to save lives around us. We want to help protect the people around us. And the hope and the expectation is that this is something that we will adopt as a community. And if we do that, then we're fine. If not, then obviously the county and the city are going to have to step up enforcement. So new orders now, extensions of the past orders, really focusing on everybody wearing the face coverings as the next step. You know, on the backside of this, and there will be a backside, we don't know when that's coming yet. When that does happen and we start feathering in and perhaps more opportunities for greater physical activity, we're going to have a better chance to do that if we have adopted the culture of wearing these face coverings now. And so that's another reason for our future. This is something that we need to get used to now. And with that, to be able to explain more about this, I'm going to turn this over now to Dr. Mark Escott, who is our public health officer for Austin Travis County.
Thank you, Mayor. I want to pick up on something that the Mayor just talked about, and that's the mandatory facial coverings. And a lot of people are asking us, why now? Why this step? Why is it mandatory? You know, as we talked about last week and in recent days in particular, a percentage of individuals that are asymptomatic who have the ability to spread is larger than we thought it was. Those that have very, very mild symptoms where they may not even think they're sick or, you know, may not be severe enough for them to seek health care may be able to spread it. And we also have increasing evidence that early on in the disease, when people are asymptomatic or they have mild symptoms, may be, in fact, the time when they are most infectious. So for these reasons, it's critical for us to take this next step of mandatory masking or facial coverings to help mitigate that risk. As the Mayor said, this not only provides protection now, but allows us to prepare for when it's right for businesses to start reopening gradually, that we are going to continue that protection effort. It's going to take time for us to get to a situation where we're comfortable wearing masks, where we have masks that we like and that are comfortable. We know that if people like the masks and they're comfortable, they're more likely to wear them. And over time, it's going to become part of our culture, at least in the short and intermediate terms. But it's something that we have to embrace. It's something we have to embrace now. It's something that's critical over the next 3-week period. That, combined with social distancing, may put us in a good position in 3 or 4 weeks to start opening the window a little bit, to start returning people back to work, returning businesses back to operation. But we cannot do that unless we really embrace that social distancing, unless we really embrace that facial masking, so that we can be in a situation where we just have a trickle of new cases coming in and we can effectively monitor and manage that risk for the community. This is why we're asking everybody to be engaged in this effort. And as the Mayor said, we can't enforce our way out of this. What we need to focus is reinforcement. Our law enforcement officers, our code officers, the general public. If you see somebody without a mask on, don't judge them. Offer reinforcement. Hey, you know, you should be wearing a mask. If you have the capacity to have extra masks that you can share with other people, you should do that and support this cultural change. If we embrace this together, if we embrace that reinforcement model together, we will get through this together. We will open businesses together. We will return to a more normal state sooner if we are all working together. The other thing I want to mention is that, remember that these are cloth face coverings. These are not surgical masks. These are not N95s. You don't need this level of coverage if you're at the grocery store or if you're walking your dog or if you're going to the dry cleaners. You need a simple cloth face coverings. Remember that the purpose of these face coverings is not to protect you from other people. It's to protect other people from you in the circumstance that you may be asymptomatic with the disease or mildly symptomatic. Again, to give us that extra layer of protection so that we can make sure that when we start to reopen things, and even now, we can interact safer, we can protect our employees, our essential employees, our critical infrastructure employees, and that we can be in a better position to get things reopened quicker. You know, we are working hard on our overall effort. We're working hard to enhance testing, and we'll be talking later in the week about those efforts and how they're going to equate to being in an even better position for us over the coming 3 to 4 weeks to start that discussion and start that reopening process. I'm going to pass it now to Judge Eckhart. You know, we've got to stay strong, folks. We've got to work together. We have to continue to choose that strength. If we are strong together now, if we're strong together over the next 3 weeks, if we're strong together in the long term, we are going to recover together and we're going to be stronger in the long term. Judge Eckhart.
Hi, everyone. It's Sarah Eckhart. We're taking a little break from Commissioner's Court where we're having a very good conversation about both the response and recovery from a healthcare standpoint and the response and recovery from an economic standpoint from COVID-19. I'll take this moment just to demonstrate a very simple fabric mask that I made out of a t-shirt without any sewing. This is what we're talking about for most people. Very simple and very comfortable.
I think I got it.
Let's keep calm and carry on with innovation and adaptation. This order, our previous order, stay home and work safe, is working. We have seen a little bit of a dip. Our unicast information shows that we, over the Easter weekend, were socializing more. And where we had an A- grade under unicast before, we have a grade of C now. But I know that we're going to get back to that A grade with regard to our social distancing. COVID-19 is not going away. We don't yet know exactly how the virus circulates in the community. We don't yet have a treatment or a vaccine. So with these uncertain times, we've had to take some dramatic and definite action. And this community has just been tremendous at responding in a way that is so effective. We now must turn our energies to our second order. It does go through May 8th because we need that time to see, for instance, in the unicast data with an Easter weekend spike in activity, it's probable that we're going to see a spike in cases 2 weeks later. We do know that there is a strong correlation between our behaviors and our numbers of cases. So we will be looking to see if we are getting a spike in cases 2 weeks hence. And that's the reason why we need this order through April 8th, so that as we look at our healthcare response and recovery, we're doing so, I use this analogy with the Commissioner's Court. I'm teaching my son to drive a stick shift car. So my analogy for COVID-19 is we're learning to drive stick on a hill. And at the bottom of that hill is COVID-19. So in this healthcare response and recovery, we're looking for the right calibration between the clutch and the gas. So we will need to be looking at the data over the next 2 to 3 weeks to see what's working and what isn't, and where we need to press down on the clutch or where we can start pressing the gas again. With regard to our economic response and recovery, we will also be looking over these next 3 weeks collectively at all of our industry sectors to see at first what inside of our essential business sectors is truly working from an adaptation standpoint. We will be adapting and innovating, and as we see what works, we'll be able to also take a look at other industries that perhaps are not currently designated as essential, but have very similar attributes as some that are, so that we can begin to apply those adaptations and innovations across other industry sectors as we start to look at how we can let up on the clutch and let the engine of business start to take hold again. So I do want to give a big shout out to our community, to our tremendous ability to adapt. And we've seen some really wonderful things through this adaptation as well. We've seen telecommuting, for instance, be a huge success. Not only is it saving lives, but we're also seeing huge dividends with regard to our traffic and our air quality. We're also seeing that some portions of our community that formerly did not have Wi-Fi, that we can use school buses and CAP Metro buses to extend Wi-Fi into communities that never had those capabilities before. We're also seeing that while we previously did not consider ourselves much of a manufacturing hub, we're now seeing the manufacturing of hand sanitizer, of personal protective equipment, even of ventilators. If we can manufacture these things locally, just think of all the things that we can manufacture in the future in a local economy. So I wanted to highlight one thing that the mayor had also mentioned. There is we are in partnership in this. The Austin-Travis County Public Health Interlocal is a long-established partnership. Our orders are almost identical, with the exception of one exhibit. But I don't want folks to get too hung up on that. That one exhibit is with regard to the construction industry. We have a shared exhibit, an Exhibit B, that goes to all industry that is currently considered essential. These are our recommendations as well as our requirements that would be applicable to all of our essential industries, whether it's a grocery store, a construction site, or a nursing home. We will be convening additional conversations over the course of these 3 weeks with all of our industry sectors to find out what kind of innovations and adaptations are really working for us into the future so that we can survive COVID-19 now and also in the future. So again, I want to stress what the mayor and what Dr. Escott has already said. We will not be able to regulate and enforce our way out of COVID-19, but through innovation and adaptation and sharing, we will find new ways to do business, new ways to interact with one another that are satisfying, that are fortifying, and that help us save lives. With that, if there are questions.
Hi there, can you guys hear me? This is Jacqueline at KXAN.
Yep.
Okay, our first question is from KView. Their reporter is asking, why was 10 years of age chosen as a benchmark for masks?
I could perhaps answer that. That was an age that was pulled straight out of statute with regard to it being an order. Orders are legally enforceable from a civil and criminal standpoint, and the age that is most commonly used in statute is 10. And we recognize that it's very difficult to require or hold a 2-year-old accountable for wearing a mask and social distancing.
Should be noted,
okay,
just real quickly on the answer to that question, that the CDC guideline recommends that children over 2 wear a mask. And while the order will not hold a child 2 to 10 responsible, it does indicate that parents are supposed to ensure that children under 10 are appropriately masked.
The next question is from Fox 7. Their reporter is asking, how will face coverings be enforced, if at all?
I'll answer that and then kick it over to the mayor. Again, enforcement here is not going to, it's not going to help us beat COVID-19. There certainly will be enforcement if we don't see a community-wide embrace of social distancing and appropriate masking. If we see really egregious violations that are threatening community health, we will certainly enforce. But really what we're looking at is we are heavily reliant on our community's will to address this through self-regulation.
I don't have a better answer than the one that the judge gave. If you look at, as the judge indicated, we're doing really well in the community right now. Still have ways to go, and we're not out of the woods. If we had some real significant clusters, we could be in a world of hurt. But the community is doing really well and is working to help flatten the curve. But that's happening not because we haven't forced our way to it. It's happening because we have a community that has recognized the need for it and has participated in that. And we expect that to continue, and we expect it now to include appropriate face masking.
Okay. The next question is from CBS Austin. Their reporter is asking, have you accounted for why 78748, which is a zip code in Southwest Austin, has the highest number of cases? And are these cases tied to one place?
That's a great question. It's important to remember that the zip codes represented are the zip codes where the individuals live, not where they may have been exposed. It's difficult. It's going to differ between various circumstances whether or not they were exposed in the same zip code as they live. We're going to be talking later this week about cluster investigations, and we will be providing a weekly report on cluster investigations so that the community can have some awareness of those things that we're investigating. We still have to protect privacy of individuals associated with COVID-19 as anybody would expect in the community. But we do intend to share that once a week to provide the community with those updates so they can be aware and they can respond appropriately.
Great. Do you believe, the next question is from patch.com. The reporter is asking, do you believe that the rate of illness in the county would have been less had the face covering requirement been implemented before? And why wasn't it mandated prior to this?
I think that as we've gone through this pandemic, we've learned a lot. We learn a lot every single day. And it's hard to speculate on, what we should have done back when we knew less. Had we known 2 months ago, 3 months ago that asymptomatic spread and mild symptomatic spread was what it is, we probably would have made decisions back then, but we didn't know that. So what we're doing now is making decisions as quickly as we can so that we can protect our community as much as we can and be practical about those decisions. Again, we still have to be deliberate and measured in our response to this. We don't want to over-respond, but we certainly also don't want to under-respond. So making masking mandatory, making facial coverings mandatory is a conversation with the community. It's involved with assessing people's engagement, their ability to make masks and other improvised facial coverings. And I'm proud of the way we've moved forward. I think we've moved forward on requiring this before most of the country has. And Austin, I think, has been ahead of the game to some extent all along. And I want to continue that. I want to continue this engagement, this partnership with our community. And I think together we are going to be stronger.
This next question is from KUT. They're asking, why is the city not publishing race and ethnicity data by hospitalization or death? It also says other municipalities are reporting a higher death rate among Black people, but there's no way to know whether that's happening right now in Austin.
That's a great question. And, this is not about, our desire to be non-transparent. It's about data flows. It's about prioritization of people's times. So far we've been focusing on testing, focusing on ensuring that people who are positive are contacted as quickly as possible. Their contacts are contacted as quickly as possible. And we're catching up on the data management piece, ensuring that we have those appropriate data flows so that we can report accurate information to you. We expect by the end of this week that we will also be providing information on the cumulative hospitalization numbers by race and ethnicity, as well as the deaths by race and ethnicity. We do want to share that. We want to have that information. We want to be as transparent as we can because we too are concerned about the impact on minorities in our community because we know that there's a lack of equity when it comes to underlying health conditions. There's a lack of equity when it comes to access to care. And we have no reason to hide that. We know it's there. We know that these communities are going to be more heavily impacted. And we want to make sure that everybody understands that. because we're going to, at some stage, move on from COVID-19. But those inequities are going to be there. And we have to continue to work hard to address those issues. We know that COVID-19 is going to compound those underlying inequities. And, I think it's important for us at this stage to recognize that we have to do more. We have to do more as a community. We have to do more as a country to ensure that people have equal access to health care, because it is a right. It should be a right. And I'm hopeful that, over the next 4 years, we're going to have continued progress towards that goal.
The next question is from Austonia.com. It's another one asking kind of why the mask mandate is happening now, but this one specifically asks, was this a decision focused purely on health, or is there an aspect of preparing for the future when contact guidelines are relaxed? It asked if this is possibly even a result of state pressure.
That's a great question. This is not a result of state pressure. We've been looking at this issue, over the past several weeks, particularly as the evidence has emerged regarding the asymptomatic and mild symptomatic spread. I think this helps us to work harder now to mitigate the current spread, but it does put us in a better place to prepare for reopening businesses. I can tell you right now, I don't want to speak for the mayor and the judge, but I'm sure that our answer is going to be consistent. There is no intention of opening the window completely. That's not in the cards. But as we open the window slowly, incrementally, in a measured way, having that extra layer of protection, the physical and otherwise, is going to help us mitigate that spread further. So if we increase, the operations of restaurants or retail, we can do so in a safe manner. And as the judge mentioned, as the mayor's mentioned before, we are working with the business community. We want to know how businesses can react to the recommendations, the social distancing needs, that effort to mitigate the spread further. How can they adapt their business to fit this new model? As the judge said, we've got businesses who've been doing it. We've had, great partnerships with HEB and other retailers who are currently open, who've implemented process changes, social or engineering processes to decrease the risk that can be applied to other settings. And so we want that dialogue to happen. We don't want people to hide best practices. We want them to share openly so that we can be better prepared when it's time to open the window to do that in a responsible way.
The next question is from the Statesman. They're asking, what is the data telling you in regards to the length of social distancing orders? What metrics are you watching, and what are the key data points to be looking for as proof that these community-wide efforts are working?
So we're looking at a number of things. We're looking at the cases, the total cases, the percent of increase of cases, which over the past 7 days has been between 7 and 8% each day on average. We've seen a doubling time, which has been drawn out to around 7 days. So we're looking at those things, but we're also looking at hospitalizations in particular, because hospitalizations give us a better picture about the total disease burden in the community. You've seen across the country, across the state of Texas, variations in the number of tests being performed and the number of positive cases. What's going to be more reliable to indicate the spread is that hospitalization rate. So we're paying close attention to that. That's the data that's being fed to the UT model, and we're thankful for their partnership. And we'll continue to follow all those things, but we're paying close attention to the hospitalization piece at this stage.
Okay. The next question is from the Austin Chronicle. Their reporter is asking, do you envision residents will need to continue wearing masks once the restrictions on non-essential activities have been lifted, whether that's on May 8th or later than May 8th?
Look, I think that the requirement for facial coverings is likely to be a long-standing requirement. Nobody expects that this thing is going to go away. We hear lots of talk in the media and from other jurisdictions about a peak. In no way is this a peak and then it's gone. That's just not in the cards at this stage. The peak that we're talking about that we may be getting close to is a peak that we've engineered, that you as the community have engineered. It's avoiding that thousands and thousands of hospitalizations and deaths in the short term, but we have to look at strategies for the long term. We expect that if we relax the social distancing completely, if we take away some of these mitigation steps, that the peak will happen very soon. What we're trying to do is buy time. And we've talked about this strategy all along, the need to buy time for more PPE, buy time for more testing capability, buy time for enhancing our contact tracing, and to ultimately buy time for two of the most critical components of this. First is identification of treatment, which is going to be successful, and the other is vaccination. Treatment and vaccination represent our ability to really transform our response and to really get back to something which looks like normal in the past. Those two things are being worked on throughout the world. We're updated on a daily basis on some of these, but really those are the two key points that are really going to help us to turn the tide. I think if you haven't seen news on really effective treatment, if you haven't seen news that we found a vaccine, you have to expect that the measures to some extent that we're talking about now are going to be in place until we have those two things.
Okay, Dr. Escott, you might get a break on this next question. This next one comes from Telemundo, and it's on SB4. They're asking, since many of the undocumented are essential workers and still have to drive to do their jobs, is there anything being done to ensure that these people won't be facing potential immigration consequences or being stopped and asked about their status during the pandemic?
Well, I think it's real important to know that everyone in our community, we want to be safe, and everyone in this community is pulling together because we recognize that if anyone in this community is not safe, then none of us ultimately are. No one in this community should be stopped now by law enforcement to see whether or not they're going to an essential function or not. That shouldn't be happening, and if that happens, you need to report it because it shouldn't be happening. It's also important that people know that if they don't feel well, if they're running a fever, if they need to go see a doctor or need to go to a hospital, the doctors and hospitals are not asking people what their documentation status is. Someone who goes to a hospital here is just going to be treated to help protect them and to protect their families. This is a city and a county where we have adopted resolutions to help make financial resources available, especially to the people that are not getting support and help from the federal dollars. Because in this community, we need to make sure that everyone feels safe and is safe, and everyone is healthy.
I'd like to punctuate a couple of things that the mayor has mentioned. This order certainly requires a certain change in behavior by all Travis County residents. But I also want to assure folks that this order does not create any kind of reasonable suspicion for any law enforcement agency, whether it's Austin Police Department, the Travis County Sheriff's Department, or even some of our smaller police departments. It does not give them any enhanced power to stop anyone for some kind of reasonable suspicion. So that has not changed because of this order. There will be no enforcement, any kind of selective enforcement with regard to our immigrant population. Further, Austin and Travis County have made substantial investments in our public health as well as our healthcare clinic. The city and the county created a hospital district so that we could have a robust clinic system that provided health care to any individual, irrespective of what their country of origin is and irrespective of their income level. It's extremely important that everybody in Travis County knows that testing is available to them if they're ill and that care is available to them if they're ill. We're expanding our testing capabilities every day. And perhaps we could go to Dr. Escott specifically to talk about the access for anyone in Travis County, irrespective of their country of origin or their income level, to access care in our community for COVID-19, but also for any other underlying health circumstance that might make them more vulnerable to COVID-19.
Hi, we have time for about 3 more questions.
Okay, let me just respond to the judge there. It's important to note, as the judge said, that number one, the testing available through Austin Public Health is free. It's available to everyone who needs to be tested. We're going to talk later in this week about a public enrollment process for those who need to be tested, where you don't have to go directly through a doctor. You can go onto our website, you can sign up, you can indicate your symptoms, and you can select a time to be tested. This is a critical step in making sure that those that had a barrier before because they didn't have a doctor or a telehealth provider can access directly now that testing. Our hospitals, our emergency departments are obligated under federal law to provide emergency medical care for folks who need it. And we know that, that a significant portion of the stimulus package is going to hospitals to support unfunded care. So as the judge and mayor both mentioned, people should not wait if they need to be tested. People should not wait if their condition gets worse and they need hospitalization because they have chest pain or shortness of breath or they can't keep their fluids in. Those people need to go to the ER. They should call 911 if they need an ambulance. They should call the ER and present themselves to the ER if they need to. They should not wait if they need hospitalization. We have plenty of access right now. The hospitals are about 50% capacity. There's plenty of room for hospitalized beds, for ventilators, for ICUs at this stage. There's no reason why we should delay that care for folks who need it. It's critical that folks access the care that we have. If they're concerned and they think it's an emergency, call 911. Our EMS providers, our fire departments are there, ready to respond if you need it. Please don't delay.
Also, I want to mention one more thing, that anyone in Travis County, whether it's during COVID-19 or otherwise, if someone stops you, always ask for their identification and make sure that they truly are a representative of a law enforcement agency or a governmental agency. Make sure that if somebody is pulling over your car or stopping you walking down the street, that they actually have the authority to do that. We have heard some reports of individuals who have masqueraded as law enforcement in this circumstance. We will vigorously prosecute people who are masquerading as law enforcement.
Okay, the next question is from Community Impact. They're asking if we are expecting our peak to come in mid-May into early June. Why is the order only extended through May 8th?
I'll take that one first, and the judge or mayor may want to comment. I don't want to predict a peak at this stage because the peak is dependent on how we do, how we as a community do. If we start to loosen things, if we start to travel for reasons that are not essential, if we start to pay less attention to social distancing and the facial masking, it's going to affect the peak. It's going to affect when the peak happens. It's going to affect when the second peak comes. I think the next 3 weeks are going to be critical for us as we had Easter last week. We've seen construction open up again. We need some more time to sort out what the next 2, 3 weeks, 4 weeks are going to look like. So that's buying us some more time to see what the impact, the total impact of our policies have been. We have to remember that it takes about 2 weeks to see the full impact of policy implementation. So just starting last Wednesday, we're starting to see the full impact of the stay home, work safe. It's going to be another 2 weeks before we see the full impact of facial coverings. So we have to have that time to assess where we are and when we can start opening that window of business again.
I would say that in addition to everything that Dr. Escott said, things are changing weekly, if not daily. So it's just hard to see a horizon that's far off. Obviously, we're going to do an order that was shorter than the governors and the presidents who had their own shelter-at-home guidance. A week after that, for me, for my side of this, just felt like the right time, recognizing that we're going to be learning an awful lot before we get to May 8th. We're going to be learning a lot every day, and we'll continue to adjust as the facts and circumstances indicate.
And please be assured that if we knew for sure when or if a peak was coming, we would tell you. We very much would like to know ourselves. But these are uncertain times. And in uncertain times, we need to prepare for the worst and then be hopefully pleasantly surprised that we collectively were able to respond in time and reduce the curve and truly save lives. Perhaps lives that you will never know you saved. But make no mistake, stay home, work safe, and now the masking requirement is truly saving lives.
Okay, the next question is from Univision. They're saying that maybe many of the people who are careful to follow the orders are angry because there are other people who aren't following the orders because they've heard that enforcement is, just kind of whether they're willing to be compliant. So they're asking if the law will ever be applied, such as a $1,000 fine or the 180 days in jail.
If the community is unable to embrace these orders, yes, we will have to engage in some targeted enforcement. But I think that COVID-19 is punishing in its own right. And the more information we can get out to folks about COVID-19 and how it operates, and really the tragedy of individuals who contract COVID-19 and have serious cases and even die from it. I think that is the most motivating, our desire to save lives.
And I think that it's also something that as our community does it more and more, people are going to recognize that that's what we expect of one another. You go into a grocery store right now, there are more and more people that are wearing face coverings. Legal requirement, I believe it's a moral requirement for us to do that to help protect the clerks in those stores and our economic first responders. But I think if you go into a grocery store a day or two ago and you weren't wearing a face covering, you could feel from among the other people in the store that you were doing something that the community just really didn't feel was appropriate. And that kind of community will, I think, is something that I hope grows and something that people feel and that they heed, so that we're all in this and doing this together to protect one another.
Okay, I believe this is the last question that we're being allowed. This is from us here at KXAN. This new order that's extended and updated does kind of include some guidelines for construction companies if construction workers are out working, including wearing masks. We've been at several sites today and have seen lots of workers not keeping 6-foot distance, not wearing masks. So our question is, what happens if, one of these essential businesses is essential, but is not maintaining a 6-foot distance, is not, upholding what they've been directed to do? This could be a construction site. This could be a really small restaurant where it's not possible to keep 6 feet. Will they be allowed to stay open?
I think that if you see violations in the community at construction sites or restaurants, it would be good to call 311 and let the city and the county know that that's happening. The order is very new, and my hope is that we get greater and greater compliance. But as the judge said, if we don't get widespread compliance with the order, and including the provision on face covering, then the city's going to have to step up enforcement measures. But it is something that is expected, and we are meeting with and working with folks in the industry to try and get the compliance. But again, if it doesn't become widespread, then we're going to have to increase enforcement efforts.
And also, I want to remark that in COVID-19, there are very real consequences to a failure to adapt. There are health consequences. The disease is deadly among a certain percentage of those who contract it. There are real economic consequences to our inability to restart the engine of commerce if we are unable to make these behavioral adaptations. And then third, there are also civil and criminal consequences to a failure to adapt to these new behaviors that are being required by the order. So again, we'll be continuing to engage with our industrial business leaders, as well as labor leaders and employee groups, so that we can understand what adaptations are reasonable and what adaptations are truly taking hold. If there is not a level playing field and certain people are taking advantage of the circumstance, those are the kind of targeted enforcements that we would certainly want to pursue in partnership with the business community. I don't think any one of our industry sectors wants to see an unlevel playing field.
Thank you for joining us. That is the end of our news conference.
Hey there, everyone. Will Dupree once again in the KXAN live studio. We've all been listening in to this press conference that has just wrapped up from the City of Austin and Travis County. You heard from Austin Mayor Steve Adler, Travis County Judge Sarah Eckhart, and the Interim Health Authority for Austin-Travis County, Dr. Mark Escott. They specifically were highlighting the fact that the new stay-at-home order that's been issued as of last night has now been extended through May 8th. And also, this new order comes with a requirement for people when they go into public and do essential activities or work that they must wear a cloth face mask. I will say that we've been reading over the order, and if you're kind of wondering how that exactly works, they do have a section in particular about face covering requirements. So I am currently working an essential job. The news media has been determined as that and deemed as such. And it says that if you're in a single space, you are not required to wear a mask, which is what I'm doing right now. My studio that you see right here is an enclosed office. I'm totally alone right here, running everything by myself, so I don't have to put on my mask. However, if I step outside the door that's just right behind the camera here, I must put on my cloth face mask over my nose and mouth. So that's just one thing that you have to do. And we have to abide by that rule as well. So we're trying to practice that here in our newsroom as well. Just wanted to let you all know in case you might be wondering why I'm not wearing a mask at this very moment. We also want to highlight the fact that there is a specific provision within this new executive order that has been sent out by Austin and Travis County pertaining to construction work. And I broke down a little bit about what specifically those are. And if you want to take a look really quickly at this full screen I made, it's a lot of text, but I want to go through it. This again is the new requirements for active construction sites. First, workers must wear face coverings and maintain 6-foot physical distance. Secondly, staggered shifts are required for sites with more than 10 active workers. Thirdly, daily briefings are supposed to happen reiterating COVID-19 safety requirements and checks for personal protective equipment for those workers. Fourth, mandated hand washing stations and restroom facility placements at least 6 feet apart. Provision for single-use paper towels and no-touch trash receptacles. And finally a designation of a COVID-19 safety monitor at every construction site. I'm going to leave this up so that you all can take this in, but again, these are the requirements now for construction sites here in the city of Austin and in Travis County. Once again, those are the requirements for active construction sites under this new stay home, work safe order issued by Austin and Travis County. We might go back through that before I wrap up this stream in case you all might be wondering about it, and if somebody might have missed it, we do want to be very clear for everybody there. So to go back over what happened during this news conference and this video conference call, our Jacqueline Powell, our anchor here, she was asking questions of the three officials who were on that particular call. Something that I wanted to point out was Dr. Mark Escott, the interim health authority for Austin Travis County, said earlier that this week they're going to be sharing a lot more data with us so we can be able to get a better picture of how COVID-19 is impacting a lot of people here in the community. Number one, they said they're going to be releasing a report later this week and at least once a week about cluster investigations. So these are groups of COVID-19 cases that have been under investigation here throughout our area, and so they're going to be reporting a lot more detail about those in particular, so we'll look out for that. Secondly, Austin and Travis County are going to be releasing data regarding hospitalizations and deaths by race and ethnicity. That is not something that is available currently from Austin Travis County. Some jurisdictions, some other counties and communities and states are releasing that particular information, but Austin and Travis County will be doing it as well here coming up later this week, so we'll look out for that too. I also want to say that Dr. Mark Escott mentioned this, and he said that wearing a face mask may be a new long-standing requirement for our day-to-day life. Again, more public health officials will be likely weighing in on that. We'll keep asking about it as well. But COVID-19 is not going anywhere. We may develop treatment and vaccines for it to be able to deal with it if you are diagnosed. But because this is going to be something that is going to affect us from here on out, such as the flu and the common cold and those kinds of things, face masks may become a part of our daily lives. And that's something really to sit upon and to think about and to ruminate on, because that's very different than where life is at this very moment. That could be a big change for us going in the future. So again, that's something to consider and think about at this time. Dr. Mark Escott, I want to point out, also said he does not want to predict a peak. That has been shared by other officials, predicting and estimating when that might happen. He is not going that far and saying that he does not want to predict it at this time. He said that all depends on how we behave and what we do at this time. And he warned that the next 3 weeks are critical for us to be able to not hit capacity for our hospitals. He mentioned that our hospitals here in the Austin Travis County area are at about 50% capacity right now, and he wants all of us to be able to do a little bit more and to abide by these requirements and do all we can so that that stays that low and we don't overrun our healthcare workers and our medical facilities. If you're wondering where the numbers now stand here in Travis County, we got an update later yesterday evening, and here you go. We now have more than 850 confirmed positive cases of COVID-19 in Travis County. 11 people have now died. 2 more deaths were reported and confirmed yesterday. 144 people have now recovered from the virus. And as you see on that other column there, 93 people are currently in the hospital, 49 people are in the ICU, and 23 people are on ventilators right now. So there you can see this is having an impact so far on our medical community and our medical facilities. And these people are suffering from COVID-19 and having some bad effects from that. Before we wrap up our stream as well, we just saw the numbers and where they stand here in Travis County. This is where it is for our entire viewing area. So all the counties that are reached by KXAN, we made up this little graphic to show that you all can see where all these clusters and the most cases are happening. If you take a look in the far northwest corner of our viewing area in San Saba County, there are 0 confirmed cases of COVID-19 right now. The most cases are in our most populous counties. So in Williamson, Travis, and Hayes counties, as well as Bastrop, there to the east. We just heard from Williamson County. They reported new numbers just about 30 minutes ago. It stands at 124 cases now. Hayes County updated its numbers, and now it shows 93 cases. And in Travis County, the reporting comes later in the evening for us, so we'll be able to update that number here in a little while here at KXAN. But right now, that number stands at 856 positive cases of COVID-19 in Travis County. Before we go, I want to tell you all, if you're here in Austin watching us, because the weather is so nice right now and it's considered an essential activity to be able to go out and exercise or hike or bike or walk, a lot of people have been going out to the Butler Trail around Ladybird Lake, Town Lake for those people here that live in the community, call it that too. And we want to point out that there is a change at that particular trail. So it was closed for Easter weekend. It's now reopened and people are out again using that. However, there is a change to the pattern that it follows at this time. If you take a look, this is a graphic, and I'm going to make it full screen here in just a moment. Once again, a Butler Trail in downtown Austin. This goes around Ladybird Lake, Town Lake for anybody who might live here in the community. The Trails Foundation and the City of Austin have now made traffic one way going clockwise around the lake. Pay attention to this. We've seen some footage from our tower cam from the Austonian building downtown of people not abiding by this direction. Granted, this is a newer directive for people who are going to be using the trail, but keep it in mind because this is the new rule, the new normal for that particular trail. Take a look, full screen. If you are using Butler Trail, you are now supposed to go in one direction clockwise. And you can see this runs the entirety of that particular trail in downtown Austin. We'll leave that graphic up just a little bit longer, but we thank you all for watching and paying attention to this pretty long live stream. It's almost an hour at this point. There's been a lot of information shared and some new rules that are going into effect today. At the bottom of your screen, you can see there Austin and Travis County are extending its stay-at-home order, which I have right here. This is the one from Travis County. It's 22 pages long, identifying and explaining what are essential activities, what are essential businesses, what are those kinds of things. So that might be something to keep in mind. If you would like to read it, it's on our website, kxan.com, and on the KXAN News app, we have a breakdown of what all these new requirements are. And then at the bottom of your screen there, face coverings are now required whenever you're going out in public to do essential work or activities. There are some things that you don't have to do and wear a mask. And let me pull that up really quickly. So there's a section at the back of this new order specifying face covering requirements there, and I make some notes there so that you all can see. Here's what you should do if you're wondering when you need to wear a mask. Let's break that down for you. So again, all people over the age of 10 shall wear some form of covering over their nose and mouth, such as a handmade mask, a scarf, a bandana, or a handkerchief. For instance, this is mine right here that I'll be wearing as soon as I leave my little office here to go back into the newsroom and be around a few more coworkers here in a moment. So when to wear a mask, these are the reasons. Number one, going into or inside any building open to the public. Number two, when using public transportation, taxis, or ride shares. Number three, when pumping gas. And number four, outside and 6 feet of social distancing cannot be consistently maintained between the person and individuals outside of their household. So if you're going out to exercise, you don't need to wear a mask, but you need to maintain that 6 feet of social distance between you and anybody else that you might be with. When you don't have to wear a mask, here's this section that is specified in this particular order. So this section shall not apply to people who are, one, riding in a personal vehicle. So like this morning when I came into work in my car, I did not have to wear my mask inside the car. Number two, if you're alone in a separate single space, again, where I am right now in this particular office where my studio is, it's separate from the newsroom, closed off from it completely. Whenever I go out of the room though, I will put back on the mask to be around my coworkers. Number three, that are in the presence only of, you don't have to wear a mask, I should say, if you are in the presence only of other members of your house or residence. Number 4, when doing so poses a greater mental or physical health, safety, or security risk, such as anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the cover without assistance. And finally, for consumption purposes, so eating or drinking in public, you don't have to wear that mask. Again, that's a lot of information to go through, and we appreciate you all sticking with us as we've been able to share that information as quickly and comprehensively as possible. We have a lot more over on our website, kxan.com, and on the KXAN News mobile app. I keep plugging those things, but you can find so many resources right there at the tip of your fingertips. All right, everybody, we are going to end this live stream. It's been about an hour now, so we appreciate you all trusting with us to share this information, put it out there. For now, I'm going to end the live stream. Please, everyone, stay safe, stay healthy, and if at all possible, please stay at home. Thanks again for watching, and we'll see you back here another time.